Now, besides neighborhoods, we're also talking about health care today.
Just a couple of hours ago, I talked with former Oregon Governor John Kitzhaber. He's a former emergency room physician and something of a local expert on health care. He believes this debate we're having should not be about how you pay for health care, but what we're buying with health care money.
Let me give you a really good example. The most frequent reason people on Medicare go into the hospital is for something called congestive heart failure. Nationally, 40% of those people go back into the hospital within 90 days with congestive heart failure. So the whole system is geared around sort of acute crisis care in the hospital. There's no incentive or system out there to take those individuals who have been treated in the hospital and keep them from having another episode of congestive heart failure out in the community. So it's an acute care system. And most of the cost in the system is driven by people who have one or more chronic illnesses like diabetes and congestive heart failure. And to keep those people stable in their home and out of the hospital requires a completely different kind of delivery model. And right now we lie in the weeds and wait till people have a crisis, and then we take care of them in the hospital for $40,000 rather than spending a tiny fraction of that stabilizing them and keeping them in their homes and in their neighborhoods.
As the father of Oregon's health plan, you no doubt have been doing some armchair quarterbacking of this health care reform debate. You had to work with the legislature to get a plan decided upon that would pass. What would be your advice to the president tonight?
Well, I think that the real challenge is to be able to first describe what an optimal system would look like. And I think we need to remember that what people really want is health, not health care. Health care is a means to an end, not an end in itself. And it doesn't really have any intrinsic value outside its relationship to keeping people healthy. So if we were to step back and say, if anything were possible, what would a system look like that would actually improve the health of Oregonians at a lower cost without sacrificing quality? And we can do that. I mean, we can describe that system. That's not a big secret. The question then is, how do you get all the people who are deeply invested in the current system, from consumers to insurance companies, doctors, hospitals, employers, etc., to move to that new system? And the debate really needs to be about how we get there, not where we're going. And we don't have time. I mean, we have so many people now who cannot afford their health care, or who have to pit their ability to buy heating oil in the winter with sending their child to the physician. And we need some relief very, very soon. So, I mean, I think they'll pass something, but I think if people think that Congress can magically pass a bill and the health care system will suddenly be fixed, that's a false hope. What we can do, however, is lay out a 5-year plan, again, starting with where we want our country and our state to be 4 or 5 years from now, and then begin to take the key incremental steps. And in that context, extending coverage to those who can't afford health care would be a very, very high priority.
It's the timing, he says, it's all important. Oregon's health plan enjoyed wide bipartisan support in the legislature and in the community because the timing was right.
That was an excellent interview. We don't have time for all of it here, but we've put Mike's entire interview with the former governor online, so you can watch it at KOINLocal6.com under featured videos. Let's go on over and check in with Chief Meteorologist Bruce Sussman.